Attention greeter. I once read this quote: "Loved with a love beyond telling, missed with a grief beyond tears." This is how a mother feels when she loses her child to SIDS. SIDS, which is short for Sudden Infant Death Syndrome, is also referred to as crib death. According to the book Crib Death, Sudden Unexplained Death of Infants, A Pathologist's View, SIDS is defined as the sudden death of an infant under 1 year of age, which remains unexplainable. SIDS is the most frequent form of death during the first year of life, striking one baby for every 7 to 1,000. 60% of all SIDS victims are males. Only 40% are female. I chose to research this topic for a couple of reasons. Most importantly, I'm a mother, and during every OB appointment I saw posts or warnings about SIDS. I also had a coworker in the past that was affected by this tragedy. It was absolutely devastating. I'm going to be speaking to you today about the history of SIDS and what you can do to possibly prevent this from happening, and some minor research surrounding it. Although the prevention and research is very important, I would like to start off by giving you a brief history of SIDS. SIDS hasn't been around for very long, but when it came to, people wanted to know everything there was to know about it. SIDS came to be in early 1969. Since this is a diagnosis of exclusion, there is inherent imperception, and this has led the National Association of Medical Examiners to recommend that these deaths are now to be classified as undetermined. Before this diagnosis, infant deaths were just simply referred to as a mechanical suffocation. The name of this came to be in 1969. It was an agreement made by the public as well as an adversary group, which came to the determination that SIDS should be referred to as Sudden Infant Death Syndrome. Early researchers of SIDS suggested that this occurs to prolonged sleep apnea. There was also a mass decrease of identified SIDS cases in early 1900s after the public was made aware of different risk factors. Such risk factors include exposure to smoke and placing a baby on their stomach to sleep. Through education, new parents can be made aware of what they can do to prevent SIDS. There is no way to ensure this won't happen, but there are some things that you can do to prevent it, such as not having toys in the crib, having a firm mattress, no co-sleeping, no smoking around the baby, breastfeeding if possible, immunize when needed, passy to sleep, no honey, don't allow the baby to overheat, and always run a fan while the baby's sleeping. All of the above are extremely important, but the most important prevention is stomach to play, back to sleep. All babies should be placed on their back to sleep, unless he or she is rolling over on their own. Back sleeping allows the baby to breathe freely and not to be face down in his or her crib. There has been a lot of research done to determine the actual cause of SIDS. It has been said that SIDS may reflect a delay or abnormality in the development of nerve cells within the brain that is critical to normal heart and lung function. Due to the age of the baby, he or she does not have the ability to move his or her head if their nose or mouth become obstructed. Not having the ability to do this would cause a decrease in the newborn's carbon dioxide levels, and if not caught, would cause suffocation. Other research done suggests that an infant can suffer from SIDS due to hypothermia, or increased temperature. When an infant is overdressed, their temperature increases, which could cause an increase in metabolic rate, which in result causes a loss of breathing control. Although the research has been done, there is still so much more to do to figure out what causes this terrible syndrome. There is technology available to semi-keep parents at ease. I know for a fact that there is the Angel Care Monitor, which alerts via an alarm of no movement if the infant stops breathing for 20 seconds or more. There is also the Halo Sac, which is a breathable blanket that eliminates face covering and breathing interference. I've explained the history surrounding SIDS, possible prevention, and research, but there's something you should know. SIDS is neither preventable nor predictable. It does not happen due to lack of vaccinations. It is not contagious. But most importantly, SIDS is not caused by lack of parenting skills, and no one can be blamed for this terrible tragedy. October is SIDS Awareness Month. Let's remember those no longer with us and do everything we can to prevent sudden infant death syndrome. Thank you.